All right, we'll go ahead and start. Tell me when we're good to go. All right, good evening, everybody. We're going to go ahead and get started, but before we do, we want to give an opportunity to our interpreters to introduce themselves. We've got interpretation services this evening in Spanish and Korean, and we also have sign language interpretation services. So I'm going to let our interpreters go ahead and introduce themselves.
Buenas noches, mi nombre es Inés Gianella, su intérprete de esta noche. Usted va a poder habilitar la interpretación en español una vez que la presentación ha comenzado con un icono del globo terrestre en la parte inferior de sus pantallas. Escoja la opción de español para oír mi interpretación. Gracias.
안녕하십니까. 오늘 한국 통역을 맡게 되는 세라텐데요. 오늘 여러분께서 한국말로 듣게 되시는데요. 그러시려면은 거기에 랭귀지 버튼에서 한국말로 맞춰주시고요. 그리고 제가 통역을 할 때 80%는 한국말로 들으실 수가 있고요. 20%는 영어로 백그라운드로 듣게 되실 것입니다. 감사합니다.
Very much to our interpreters. We appreciate you being here, and thank you to everybody who's come out this evening. We obviously have a hybrid meeting this evening. We've got, looks like about 30 people online and certainly a few folks here in the room, so we appreciate you taking the time to be here. I'm Sloan Presidio. I'm the Chief Academic Officer in FCPS, and if you were expecting Dr. Reed, we're expecting her as well. I think she's going to be here this evening, but she had another community event and she's definitely delayed, so hopefully she'll be able to make it before we wrap up this evening. This is a community conversation about ESSER. So our ESSER funds really are those federal funds that we've received from the government to support the safe reopening of schools, as well as the continuing safe operation of schools following the pandemic. So hopefully you're in the right spot. I know it's a little confusing because we've been running these community conversations all fall, as Dr. Reed has had an opportunity to get into each of our pyramids. So if you do have questions on something else, we can address those as well, but this is really meant to be focused on ESSER this evening. And again, thank you for coming out. December 13th, at the middle of the holiday season, we know this is a really busy time for everybody, and we really appreciate you taking the time to be here with us this evening. So I've just got a few slides that I'd like to go through to provide a little bit of context about what we're doing with our ESSER program, and then we'll open it up for some discussion. So to start, I just wanted to explain a little bit about the big picture purpose with respect to ESSER funding. So the federal government passed the American Rescue Plan Act, and part of that was the development of funding that they titled the Elementary and Secondary School Emergency Relief Fund. So that's the ESSER acronym for short. And the rationale behind providing that funding was, again, to make sure that we were able to reopen schools across the country safely and maintain safe operations of schools. One of the biggest components after we cleared those safety hurdles was to really make sure that there was funding available in schools to be able to support the academic and wellness recovery needs of students. We know throughout the country and around the world that students' learning was significantly disrupted as a result of the pandemic. And we know that certain subgroups of students were impacted more than others. For example, here in Fairfax, we've seen some of the biggest impacts on our English language learners because they didn't have those opportunities to practice English language and get the types of language development support that they would have gotten if they were in school. Many other student subgroups experienced similar difficulties. So the federal government earmarked a lot of money to go to public education to support academic recovery as well as wellness recovery. In Fairfax, we received $188 million in our ESSER funds. We received the first initial allocation of funds in December of 2021. So just over a year ago, basically today, we received the initial allocation of our funds. We actually have until September of 2024 to expend all of those funds. And this is another area where I think there's been a little bit of confusion in the community. Some media coverage has suggested that all of the funding was supposed to be expended within the first year. That is not true. That was never true. All of the funding, we have until September of 2024 to expend that funding. And that was very intentional on the part of the government because they knew that it was going to take significant time for students to be able to recover from the pandemic, that we wouldn't be able to recover all of that academic and wellness support that students needed within just 1 year's period of time. So in Fairfax, we built a plan, a multi-year plan that runs through September of 2024 to provide those supports, those academic and wellness supports that students need. So thinking a little bit more just about kind of the process that we use to develop our spending plan. We're in essentially 1 year having implemented our plan. A lot has happened in a single year, but before we even developed our plan, we did a lot of community engagement. We had focus groups, we ran surveys, we included all of our stakeholders, our students, our parents, community members, staff members, and really helping to provide input and ideas and suggestions about how should we take this, basically once in a generation investment in public education, and how could we invest those funds to have the greatest impact on student learning. The categories in terms of how you can spend that money are provided by the federal government though. And they're represented, of course, here on this slide. So again, most of the funding was really meant to address those academic and social, emotional, and wellness needs that students had. There was the additional opportunity to provide funding to support operational needs, to make sure, again, that we're maintaining healthy school environments. So here you can think about things like investments in air quality or HVAC systems in schools to make sure that schools were safe. As part of the community engagement process that we ran over the last year, we developed an initial spending plan. We allocated our funds to schools, and we've actually completed 2 accountability reports in the past year. We did one in February of 2022, and we did another one in November of 2022. So just a few weeks ago, we presented the second accountability plan. So we've been kind of tracking the impact of our spending and sharing that information as broadly as we can. We are required to submit an update to our plan. So we're required to do that by December 31st. As part of that requirement, we do need to do community engagement. We've been doing that all along from the very beginning. So we ran a community engagement period that was open basically during the month of October and closed in November. But looking at that participation in terms of how much community input we had, it wasn't really that significant. We had 700 members, community members, complete a survey that allowed for qualitative feedback in terms of our spending plan. And we also ran a public hearing. So basically the public hearing was individuals that wanted to speak about the plan had the opportunity to come to a school board meeting in November. We only had 5 individuals who were interested in doing that. So we wanted, before we submit this plan on December 31st, to provide one more opportunity for community input, which we're doing here tonight. And this hybrid format, I think, is helping us pick up just a few more people. So that's good. And we certainly appreciate everybody who came out in person as well. Just a few more slides that I wanted to share as we think about the impact of our plan. We've really only had funding for a year. And in terms of being able to measure the achievement, when we look at standardized achievement results, we're really looking back to basically last spring because our students haven't taken their state standardized assessments yet this year. They do it in the spring. But this slide basically represents some of the initial impact after schools had ESSER funding for essentially half of a school year. And on this chart, you can see that FCPS's academic recovery is actually pretty strong. And I think I'm blocking it for a few of the friends that are here in person tonight. But what you can see in the blue color chart is state assessment results in reading. And you can see where we were before the pandemic in the first column, and then you can see where we were in the middle of the pandemic, and then you can see where we were at the end of last year. So for reading, for example, we've almost essentially fully recovered in terms of being back to our pre-pandemic level. And that's really good after only a year's time or only half of a year's time of having ESSER funding. Math, we've got a lot farther to go, but we've recovered more than 50% of the learning loss in math in just 1 year as well. So we feel positive about that, but we know that we have a lot more work to do, and we have work to do for specific student subgroups as well. Another thing that we wanted to share is, how are we getting results and how are we investing the money and what does that return on investment really look like? So the big picture view of addressing learning loss essentially is most of the funding that we've provided, $100 million, $102 million out of the $188 million, has been sent directly to schools based on the number of students that have identified learning or wellness needs. So we took our standardized assessment results and we looked at the number of students who were behind academically at each school. And we devised a formula to be able to allocate funding to schools based on the number of students who needed additional services. Schools are using those funds to essentially provide small group support or individualized support to students. So most of those funds are going to hourly pay to staff who are working beyond the day to support students, or to additional staff that were brought in to support students. So intervention and support services are occurring both during the school day, as well as before school in some schools, after school in many schools, and on the weekends in some schools. But most of that funding that schools received is really going to that hourly pay and support. Schools also had the ability to use their funds to buy instructional materials. So some money went towards the purchase of individualized computer software to really support individualized student learning needs, for example, or other materials that schools needed to work with students in those individualized or small group tutoring support sessions. Another category that we've invested some of those funds in is professional development, because we need to make sure that our teachers are adequately trained to provide high quality instruction, even after the academic recovery period has been completed from the pandemic. So we've invested very heavily in literacy training and math training for teachers to make sure that we've got high quality instruction happening in all of our schools. Now, in terms of the school-based accountability for their funds, every one of our schools has developed a very specific school improvement plan that lays out basically where their student achievement data is for the year. So starting with, where is that student achievement data at the beginning of the year? What goals do they have to address the academic needs of their students? What activities and strategies are they going to put in place? And then they've identified very specifically how their ESSER dollars are going to be used to support those activities and strategies. Each of those plans are posted on the website, so folks in those individual school communities can look and see exactly what's happening with respect to the work that's occurring in those schools. And each of our schools is working on a quarterly basis to review their student achievement data and make sure that the strategies and activities that they planned and that they're funding are having an impact. If they're not, they're working to adjust those activities and strategies, and they're getting a lot of support from central office. So from the region offices, as well as some of our academic departments are providing a lot of coaching to schools to make sure that they're actually getting a return on investment for the work that they're doing using their ESSER funds. Another big investment from our ESSER funds was summer school. So for the past 2 years, we essentially have used ESSER funds to extend summer learning opportunities very significantly for students. So we have almost 3 times as many students over the last 2 summers who have received support during the summer than we have typically been able to fund pre-pandemic. So that's been very helpful to a lot of our students. And without that funding, the ESSER funding, we wouldn't have been able to do that. I also just briefly wanted to share with you another kind of way to look at the impact analysis of what we've been doing with respect to ESSER funding. So we track and monitor every student who's been identified to receive additional support services using ESSER funding. I won't go through everything on this chart with you, but you can see basically the number of students that are receiving supports in reading and in math. You'll see tiers on that chart. So tier 2 means that there's additional need that has to happen typically outside of the classroom, that a student needs support services beyond what can happen in the general classroom. And then tier 3 means that they need the highest level of support. So you can kind of get a sense of how many students in those additional tiers, those different tiers that are receiving support with ESSER funding. But the main point of this slide is that we're seeing a dramatic decrease in the number of students that need those identified supports. So we've seen a decrease in reading of 27.5% of students needing that additional support and intervention, and a decrease in math of almost 36%. So that's pretty good basically for students who've only been receiving those services for half of a year. Keeping in mind that ESSER funding, again, can be used through September of 2024. So we know we've got a lot more work to do. There's definitely student need that needs to continue to be supported, but we are making good progress after just an initial period of having the ESSER funds. So hopefully that gives you just a little bit of context about what ESSER funds are, how we're using them, what our own internal accountability system looks like, And now what I'd like to do is kind of open it up for a discussion. I do have some guiding questions, and we've again got folks online. I would really invite you, oh, and Dr. Reed is here right on time, right when we get to the discussion, so that's going to work perfectly. Welcome, Dr. Reed. We'll let you get settled in here, and then you can help with the discussion. But we do have some guiding questions that you could refer to, but we're also happy to take any additional questions that you have, or any additional feedback that you have, certainly, on how we could be spending our ESSER funds to really maximize impact for our students. So, is there any brave soul who'd be interested in going first and offering any questions, thoughts, or suggestions? And if folks are online, our technology team is going to help us to get their voices into the room as well. Go ahead.
Thank you for inviting us tonight. I really appreciate it. I think I'm going to go with bullet number 3 about what you guys need to be aware of.
Yeah.
I participated in a recording of the November 29th ESSER board meeting. And I'd just like to echo your thoughts when you presented on the survey that was presented on SEL. 800 people responded. While not representative of the county, it is a good indication of the feedback regarding academic over SEL. I'm a little concerned that SEL is, I think there's a better way, more strategic way of saving money by maybe focusing on SEL as more of an opt-in versus opt-out, because a full broad blanket of SEL may not be needed, especially for many of the students. And I can tell you when my kids are offered the SEL survey twice a year, I feel like we're creating a culture of helplessness. I feel like with these intrusive questions, that sometimes kids start to think, well, maybe I do have a problem because I keep getting these surveys. The youth survey was 173 questions. And kids are going to start to think to themselves, maybe I am helpless, maybe I am depressed, maybe I have a gender dysphoria, whatever it may be. And I just think it needs to be opt-in, because every time I have to opt my kid out because I am concerned. And I just think it's gaslighting our kids, plain and simple. I just think that we need to really be careful about social emotional learning. I really think we need to get back to academics and focus on math and reading. The kids aren't writing enough. And so I'd rather have some of that funding going to essay writing, developing critical thinking skills so that they start putting pen to paper and start developing logic and reasoning and critical thinking. But instead, we're always lecturing them on social emotional learning and what's your problem? You must have a problem. You know, I want them to build resilience. And so that's why I came here tonight. I just think we need to be very careful with SEL and focus on what you guys do best, teaching, not psychology. So anyway, maybe just do opt-in, you might save a little money. Thank you.
Well, thank you very much for those comments. And definitely we appreciate you being here with us tonight.
Well, thanks, Armand.
Well, now Dr. Reed and I can do this together. So this is good. This is like co-hosts of the
Nice.
forum.
Thank you, Sloan.
Unless you'd like to retire me, just let me know if you decide to do that.
Oh, no.
Oh, okay. But thank you for that, and thank you for getting us warmed up. And this is why we thought this format would work better than what we had done in the past with the surveys and the public hearing, because we could actually have a little bit more dialogue and really hear about your concerns. So definitely SEL is one of those areas where we've had mixed feedback from the community about the work that we're doing. And as we continue to, learn how to do that work really well, we need to be obviously very responsive to our students and our parents. So we appreciate your thoughts and comments on that. Definitely, we will take those under consideration, talk to the team about, what that work could look like in the future. So we appreciate it. Thank you. Can I ask what grade students you might have in the system?
8th and 11th.
8th and 11th. Okay. All right. And the reason I asked that is because we've heard some concerns from our older students more than from our younger students about some of that work. So thank you for sharing.
And
that.
I'll just say for the 8th
Oh, wait.
graders, for the 8th graders, my son came home and said half the kids don't even know the questions Some of the questions are intrusive, and there's the whole data mining aspect to it that bothers me as well. And I never see the results of SEL. Where's the data? Who are you selling the data to? Who's getting it? I mean, it's just kind of uncomfortable.
No, I appreciate that. I will say that, we don't sell any data, and we do have very strict data confidentiality agreements with any vendors that we work with that prohibit them from sharing the data, and they only have access to the data to support the work that we're doing in the system. But I definitely appreciate and hear those concerns, so thank you. All right, so again, we've got folks online and here with us in person. Is there anybody else who would like to share?
Don't want my back to the camera.
We do have someone who has a question online.
Okay, let's go to our online question then, if somebody could help me with that.
So Mr. Hall.
Mr. Hall, go ahead, please.
Hi, it's a little funny here. I'm not seeing the audience. I'm seeing the slides, so forgive me for that. And I think I can keep this to 1 minute rather than the 2-minute limit I usually have. So hopefully that gives everybody space. I'm going to kind of respond, I guess, mostly to your third guiding question. And with my statement, I'm not really going to quibble with how well or how you're doing what you are doing, but I am gravely concerned about what FCPS is not doing. And by that, I mean that, stakeholders who are in your buildings, we haven't really heard about, all the safety mitigations measures that could be happening. And that includes a lot of county employees. I'm a member of SEIU Virginia 512. I represent county employees. And so SAC workers and school health aides, they're in that category of people that are stakeholders. And I'm not sure how their voices were a part of the process. But the other things I want to say is that since the schools were forced into letting students opt out of masks, we've had a lot of new COVID cases. And according to my research, you pick it, the lower range is maybe 5%, the upper range is 15%. That's the percentage of people who will end up with long COVID as a result of exposure. And I don't see anywhere in the ESSER plans that there is something that will address what are you going to do about long COVID, students who may be in and out. And in particular, I think the go-to model that you would have is the homebound program. I have experience as a homebound teacher. And that program, I think, was fairly under-resourced before the pandemic. I think when more cases manifest, if the decision is to send students at all levels to homebound, I don't think you have enough staff to do it. And I think it would be good to come up with community models based on input about what are the other ways. I do appreciate the tutor.com, but if it's a long COVID case, you're talking about people that like cases like my daughter had 10 years ago, where she missed a significant amount of school, and it was a constant struggle for her to catch up grades 8 through 12. So that's my concern. How do we bring in other programs that have not been considered and are not currently residing in the school improvement plans? Thanks.
Yeah, well, I mean, I think Mr. Hall's brought up the homebound, and I think that is something we need to think about even pre-COVID, right? How we resource that. I don't know about the staff input that he's referring to. I do know we've got quite a bit of money, not even just ESSER dollars, but quite a bit of money to HVAC and updating filters and those types of things around safety. But you would probably, Sloan, better know kind of how the input was taken.
Yeah, so, whenever we do the community input opportunities, we open that up to really all of our stakeholders. So when we formulated our initial plan, we did that very broadly and also very intentionally with targeted focus groups to make sure that we were hearing from folks based on, their position in the school system, whether it was a student, whether it was a parent, whether it was, school-based employees. We included all of those folks very intentionally in the initial development of our plan. And certainly, when we first got our funding a year ago, we were very focused on the health and safety conditions of our schools. And as Dr. Reed mentioned, we did make investments in air quality in our schools. We made investments in mitigation strategies so that we could, socially distance students. And, so for example, you might remember a lot of the, outdoor classroom spaces that we created. Lots of those types of things were funded through ESSER. And largely came from suggestions of school-based staff to make sure that we were doing those things, as well as from parents who were concerned about the health and safety of their students and children. So as we continue to do these community input sessions, and we're going to continue to do them throughout the full cycle of ESSER funding, which runs through September of 2024, we'll continue to make sure that there's opportunities for stakeholder voices to be heard. This past October-November session, when we ran the survey, we had about 20% of survey respondents who were staff members. About 75% of the survey respondents were parents. So we're not getting as high a percentage of survey respondents who are staff members as parents, but we are still getting a significant amount of school-based employee, I think, input into what we're doing. But we certainly welcome ideas and suggestions to do a better job with that. And we can continue to improve there. So thank you, Mr. Hall. We appreciate that. Are there any other folks online or in the room who have questions, comments, suggestions for us? Yeah. Oh, thank you. I'm used to having somebody help with the microphones. That's very nice.
You get into a rhythm after a
And
while.
you're a lot faster than I would be, I have to point out.
Thank you so much. So I did a little bit of research into what, the ESSER funding could go into. And one of the things that is allowable under the ESSER fund is college and career readiness. I know we didn't really touch upon that, but considering the ways that the pandemic has eroded post-secondary plans and also outcomes for students, such as drop in college admissions, change of plans, just loss of direction for students, is there any consideration for FCPS to use ESSER funds for college and career readiness as well?
Well, I think that's a great question, and you are absolutely right. That's not something that we initially invested in. We really invested, again, in academic recovery because, the number of students that we had that were behind was so significant. Now we're making progress there. And as we think about funding in the next year and the following year, I think that's something that we definitely can consider. And I think you have a great observation that that's another area where we have seen impact, right? So we have seen a slight decrease in the number of students who are going on to college as a result of the pandemic. And certainly making sure that we're addressing those students' needs would be something for us to take into consideration. So thank you for raising that up.
Any questions, somebody online?
Oh, excellent. So we're going to go online to Emily.
Hi, thank you. Hope you guys can hear me. Thank you, Dr. Reed and Dr. Presidio, for putting this on. Thanks to all the staff and interpreters who are helping out. And my question is about summer school. So I know 2 summers ago, we had a very robust summer program. This past summer, we still had a pretty large summer program that was slightly smaller than the previous. And I know, Dr. Presidio, you mentioned that the funds can be used, centrally through not this coming September, but the following September. So is money set aside for there to be a similar expanded summer program this summer? I'm speaking specifically from elementary because that's my role. But is there a plan for summer school for this summer and maybe even the following? Is money being set aside for that? I know specifics probably won't come together till later in the winter.
Oh, thank you for that. Thank you for that question, Emily. We will be using some of our ESSER funds to support and supplement our FCPS funds to provide enhanced and extended summer school opportunities again this summer. We are still in the initial planning stages of that. And what we always do is we look at the number of students with anticipated need to be in those summer programs in terms of thinking about how we're budgeting for that. So the initial planning for that is definitely underway. And we're going to get closer to having finalized plans really kind of early to midwinter. So a few more weeks and months and we'll have more specific plans. But yes, we'll have expanded summer opportunities again this year.
Emily, could you share with us what content area you have the most concern about? Just that I know it's one data point, but I'm curious what your thoughts are.
Yeah, I'm speaking as a staff member. And I the past 2 summers, I was the like site director for our program. So I'm just kind of speaking as like, just planning for, I know staff are interested to know, what their summer plans might be. So I'm just kind of speaking specifically about knowing if it's, if we can anticipate it happening or not and how large, we might expect it to be. But I know there was a lot of, speaking as a site director for our program for 2 years, it was a really positive program. We got a lot of really positive feedback from families. They're really grateful for their child being able to participate in it. It had, reading and math focus at the elementary level. And so I know there's a lot of gratitude to have the program. The staff also enjoyed working it. So that's just my feedback. Thanks.
Yeah, well, thanks for jumping on. Any tips for inspiring staff to want to help out this summer as well? I know we are always looking for ways to take our game up in that as well.
I know, yeah. As a site director, I know there's a lot of, running around to people asking them to participate because it's hard getting, staff, everyone in the school puts so much into our work during the school year that it's hard to get people to, give more beyond that. But we also had, reaching out to people online, making connections between schools helped, and just kind of having those personal conversations to staff members, kind of encouraging them. I was able to, fully staff my program the 2 summers. So I was grateful for that.
Thank you.
Mm-hmm.
All right, thank you, Emily. Anyone else with questions or input, feedback for us on our plan? Yeah.
Hi. My question is just related to, we talked about a little bit from a wellness standpoint, if some of the things that you are looking into are also related to teachers and administrators, because obviously the pandemic has had quite an impact on adults as well. So I just wondered if I could get your take on that as far as paying attention to teachers and administrators who obviously directly impact our children.
No, absolutely. Thank you for that suggestion or question. I think what I would say is we've tried really hard to think about things that we can do for our staff as well. So, that has been first and foremost in our mind. We've thought about it when we've thought about workload. We've thought about it when we've thought about, flexibilities that staff need. We've thought about it when we think about support services that staff might need. But we typically have tried to utilize the funding and the programs that we have within FCPS. So for example, one program we have is the Employee Assistance Program that provides a lot of different support services, all the way from, financial advising to, counseling and support services for, folks that need to access that for their mental health and wellness. So we've tried to utilize some of the things that we're already funding and that we already have in our infrastructure that are maybe underutilized. And really tried to tap into those first. And we've thought more about the additional resources that we have, really expanding those support services out to students. I'm not saying that's right or wrong. It's just that was kind of how we developed our initial plan. So I think hearing your thoughts and feedback on that are really helpful. And I don't know if you have any specific recommendations or suggestions or things that you think are, maybe missing and lacking that we really need to think about as we, revise our plan for the year.
I'm not sure if I can speak to what's missing or lacking, but I actually come into schools and I do mindfulness and wellness talks. And what I notice is that there's a big difference between the teachers that I saw pre-pandemic and the teachers that I saw post-pandemic. I impact the kids as well, but I just noticed that. And I feel like what I see are a lot of stress teachers, and that maybe could use some of the programs to help them with their own mental wellness.
No, definitely. All right, thank you for that. I appreciate it. All right, we're going to go back online to Kay.
Hello, good evening. Sorry if my accent is not perfect, but I have
You sound great.
Thank you. I have this question. I have 5 kids in FCPS, and I'm seeing that we go through too many difficult times after pandemic and all that. But I was thinking, when FCPS are going to bring back the lunch menu that it was like 5 years ago for kids, because the nutrition now is very important for kids.
So Kay, help me, are you talking about the salad bars or is there something else about the lunch menu? Hot lunch?
Yeah, the
Don't we
salad
do hot
bars,
lunch?
fruits, vegetables, all that you had before. And now, I mean, I know you're doing great job because many of parents, they cannot send our kids with lunch to school or breakfast for many strugglings and stuff like that. But, you know, I'm being in the school and I saw the food and I tasted because sometimes I ate with my kids. But I'm considering to send another kind of food to my kids because there's not much to choose as before.
Okay, well, I will take a look at the lunch menu. We're actually working on that right now with a 5-year plan with food and nutrition. So we'll take a look at that. Fair point. Thank you for raising it.
Thank you, Kay. Anybody else in the room have a question or a suggestion right now? If not, we'll go back online. I thought I saw a hand online. Is there a hand online? Shelley. Shelley, go ahead, please.
Yes, okay, hello. Let me see if I can put this on. I didn't want to have the video on. So I saw a study, or I heard someone talk about a study, and I looked it up today, and it was on school sport participation during adolescence and mental health.
Shelley, I don't know if you can hear us, but you froze on our end.
Statistically significant predictor of lower depression symptoms, lower perceived stress, and higher self-rated mental illness in young adulthood. Could we use the ESSER funds to fund athletics in middle school, or maybe fully fund the athletics in high school as opposed to using the athletic booster money?
Shelley, it's a great question. You cut out in part of that, but I think what you're saying is if we go upstream, keeping kids active and engaged helps mental health, right? And I don't know that we can use ESSER dollars for athletics, but we are looking at how we might provide more experiences athletically for middle schools, and also looking at a budget, just our general budget, how we can support particularly schools that don't have as robust a booster club, because we know that there are really inequitable funds raised for programs depending on what pyramid you are across the division. So I'd be really interested even in a conversation offline with you about some ideas. I think the more active our children are, the better food they eat, the more rest they get, the better our mental health in general.
Okay.
Yeah, thanks for raising that.
Okay.
All right, do we have anybody else online who's got a comment? George, all right. George, go ahead.
Hey, good evening. Sorry for the background noise. Question on the ESSER money and mental health. I think heard the last 3 questions in different aspects. The youth survey data. Is there any way to hire? Is there money through that way to hire help to distribute to granular, make the youth survey data that says a lot about our emotional state of our kids into each school and then post it to each school? Because right now it's not at granular level. And it's $3 million from the county to do that youth survey. You guys own the data. And I've heard that it's resources, manpower to get to that X hours of work to make it to that level to then get it to each school's website, which I think we're talking about mental health and emotional. We need a baseline of where we're at. And I think most parents love them to death. They don't care really about pyramid, but they do care about their individual school community and communities they live in.
Yeah, thank you, George. I'm not exactly sure about that. I think that's something maybe to think of a little bit more, and maybe you and I could talk about that offline. Just for folks who are here with us, George is a great community advocate, and he works with us in FCPS on a number of different committees. And George and I were actually in a meeting at the county just last week where we were talking about the mental health crisis and issues that we have, not just in our community, but around the world. But we were really focused on what we could do in our community. And George had a lot of, I think, really positive advocacy for the county and the school system in that meeting. So I appreciate you raising that up again here today, because there is more that we need to do. And I certainly would be happy to talk to you more offline about, what that might look like in terms of, greater transparency and sharing of the youth survey data. But off the top of my head, I don't know exactly what that looks like right now. So I need to work with you offline on that a little bit more.
Yeah, George, is the ask that the Healthy Youth Survey data be accessible by school?
Correct.
Is that the ask? Okay.
Correct. And it's 6th, 8th, and 10th grade. But yeah, for example, at the elementary level, you can't get it by school, but you can get it by middle school and high school, because they're breaking out in pyramid. So you can deduce by deduction, what high school, or middle school your child goes to. But for the individual elementary, you can't. And by the time the youth survey takes 6th grade, their kids are already in middle school, so yeah.
Yeah, we definitely can look at that with you. I appreciate you asking that and offering that suggestion. So thank you. All right, other questions, comments, feedback for us? Is there anybody online with anything? Okay, so we're not seeing anybody online. Oh, Jimmy. Jimmy just raised his hand. Go ahead, Jimmy.
Hi, can you hear me?
Yeah, we hear you.
So I just have a general question regarding kind of the indoor air quality and like what, I understand they're making these improvements, but is there any type of like third-party specialist, in like say microorganisms that actually test to see if these improvements have actually worked? Because it seems like they're just, doing the same old thing, and the ESSER funds were to kind of, reopen schools, but to help prepare, say, for the next pandemic and mitigate, there's better technologies to kind of mitigate the spread of, infectious disease. All these mechanical improvements are mechanical, and the pathogens have to move from their current site, like on surface, into the HVAC system to even work. So these are tiny improvements, and there are technologies that exist that put out a reactive oxygen species that actually goes to the surface and it interacts with the virus on the spot where people act, and it deactivates the virus. And I was researching this, and there's a company that does this, and they also provide pre and post test assessments. So they have like tons of metrics that they use, because I've seen other gimmicky stuff where they spend the money. Oh yeah, we got an air purification system, but it might work in this little demo, but when you scale it out, it's just wasting money. It doesn't work. So I'm just wondering how your approach to that is going. Plus, I don't see a lot of money allocated, because there's articles I read about, there's my cousin's a teacher there, and she has an issue with allergies to just mold, and I know mold is kind of a big thing with buildings and all the such. So thanks.
Jimmy, if you have a product that that you were just describing, if you can send a link to it in the chat, that way we can capture it and take a look at it. I think that would be really helpful.
Oh, I absolutely can. And I have also have a point of contact where, if you give him 15 minutes, I'll let him explain the technology, and they actually use it in the food industry. So you can't kind of like fake the food industry, because there's so many regulations. So if it works there, it must be something.
Yeah. Well, if you can put the point of contact in there in the chat as well, I'll have our facilities, someone in facilities get in touch with either you or the point of contact, because honestly, we're running down everything that has a possibility of improving our learning environment. Also want to share that, that we're changing out filters. I know quite a bit more often than we traditionally did, and also running outside air in at a much higher ratio, which is creating power costs, but, you know, we have to have more external error as a ratio to internal error. But I think
that's the thing. This works 24/7.
Oh, nice.
The value is you're not like, if there's like an outbreak or an epidemic, you don't have to like bring in more staff, buy more cleaner. You know, this is kind of a mitigation where you keep more students, like the absentee kind of level, I assume, would be better. And I assume that's how funding is based on how many kids kind of, attendance and all that stuff. So.
Well, I mean, we know that children learn better if they're in attendance, and we certainly want to keep our staff in attendance. So if you'll put the contact and the information as a link, I know there's somebody monitoring the chat, and they'll pick that up, and we'll route that to Mr. Fanshawe in facilities, and we'll have someone get back to you.
All right, really, really appreciate it. Thank you.
Yeah, thanks for jumping on tonight and sharing that.
Thanks.
All right, so we do have a few folks online with questions, but I just want to check again in the room. Is there anybody who has any questions, comments? All right, we'll go back online, and it looks like we're going to iPhone next.
Hi, good afternoon. Thank you very much for the session. My name is Angela Prigozhina. My daughter is in the 8th grade, and I have 2 questions. Can you hear me well?
We can hear you very well. Thank you.
Thank you very much. My first question is about use of digital instruments, in particular computer. I welcome that the school has prohibited use of phones, but it seems that during the pandemic, we all got addicted to using computer for everything. So I've noticed that many teachers continue to rely upon digital sources for teaching during the class time. And as a result, it raises some concerns. First, I see complaints about the eyes problems and of course, growing headaches. But I also would very much welcome that after the pandemic, when everybody was in isolation for many years, and of course had some mental and other issues, the class would offer much more interactive discussions and work with teachers without digital means. If teaching and school relies and continues to use digital sources of teaching during the class, and what's the point of coming to school? You can continue doing online studying, right? So I think this is something which probably needs to be measured and portioned during class so that kids get much more engaged in consultation discussions with their peers and the teachers. And we come back to kind of a little bit more normal class practice. And the second question relates to the content. I was told recently that this is much more defined by the curriculum, but I've noticed that in some classes, for example, Spanish, which does require a lot of intensive memorizing and learning of phrases, dialogue, words, kids are distracted by doing lots of projects which probably belong much more to social studies or history. I do not know, but I've noticed that content-wise, there is much less Spanish than I would expect, while at the end of the day, kids would be tested and will have to pass their test to confirm that they actually know Spanish. So I wonder whether it is possible to review curriculum and at least focus much more on the substance. Thank you.
Thank you, Angela. I think all things in moderation with technology, and I share your concern because obviously it's the human interaction very often that we want to nurture. Dr. Presidio, I know you, in kind of thinking about using the computer in the classroom, I think your thoughts would be helpful, as well as the content of learning Spanish in Spanish, I think would be, obviously it's a thoughtful concern.
Well, thank you again for those questions. I mean, I would just echo what Dr. Reed said. We definitely are not using technology as the primary instructional mode in the classroom. That is important time, and I think you said it very well, for students to be working together, speaking with each other, really collaborating with each other, communicating with each other, and obviously doing the same with their teachers. So we really are asking that the primary mode of instruction in the classroom be that old-fashioned face-to-face communication, But there is a powerful role for technology in terms of access to information, the ability to demonstrate your learning through products and artifacts that you can create through the use of technology to really demonstrate your learning. There's personalized learning pathways that we can use with technology software applications, but we really try to privilege that happening outside of the main focus of instruction in the classroom, which again is really supposed to be personalized. Similarly in Spanish, I think it's hard to really know what that looks like. I think you did a good job describing your concerns. But again, we learn language through listening, speaking, reading, and writing. We know that. That needs to be happening in all of our world language classes. And I think probably what I would say is if you have concerns about what that looks like, I would really encourage you to talk to the teacher first and talk to the building administrator in the school and see if there's some changes or adjustments that could be made if there's not enough time really being devoted to those oral communication skills, which are so critical when you're learning a second language. So thank you for those questions, and hopefully that's a little helpful. All right, before we go back online, anybody in the room? I'm gonna keep checking until I get another one. You watch. All right, we'll go back online, and it looks like Jenna, you're next.
Thank you, and thank you for this session. I would like to go back to some of the conversations around mental health, but with a slightly different focus. First, I did want to actually emphasize some comments earlier from Emily Vanderhoff around supporting staff and educator wellness. That's something that has been advocated for by years from the PTA and other groups, and it's definitely vital. The other thing I wanted to follow up on is some earlier advocacy around our ACE interface program, and perhaps we've talked a lot about using ESSER funding. ACE interface is a program that looks at how adversity affects us, drawing on public health research for decades. So it talks about brain development and physiology, which is absolutely, obviously vital to learning and a strong connection to a student's ability to be successful in school. So we have the infrastructure with over 12 ACE interface presenters connected to Fairfax County. But right now, the program is really, if people know about it, they can request it. We're not proactively telling the community, our staff and our families and our partners that this information and this program is available. So it would be fantastic because it does cover adversity, it covers resilience, and it covers how all of that is connected to the classroom, both at for young people, but how it affects people throughout their lifetime. So this is something that really connects the dots in many, many ways. It's extremely relevant to the task ahead of us as we recover from the pandemic. And so again, the ask would be, how can we use ESSER funding to take better advantage of this resource?
So Jenna, thank you for that. And I appreciate you bringing to our attention some of those community-based resources that we could use to better support our students and staff. I was wondering, has anybody from our wellness team reached out to you to talk more about how we could incorporate some of the ACEs work into what we're doing in FCPS?
No, not yet.
Okay. All right. I apologize for that. I thought that had happened. So I will follow up with the team and make sure that we get in contact with you. And if you don't hear from me, I mean, the winter break is coming up, but if you don't hear from me like right after the break, please do email me and then we'll get in touch and we'll figure out how to set up a time for us to connect, because again, you're a valuable partner there. And I know that you've got some good connections and resources that we could benefit from. And we can have some discussions about, how ESSER might factor into some expansion of that work. So thank you.
Yeah, I want to echo that Jenna presented that work, and it does sort of capture all the pieces we're talking about. So yeah, thanks. Oh, we have a gentleman in the room, Jenna, that wants to know what program you're referring to. Can you do a 2-minute sort of, yeah.
Sure.
You bet. I'll bring the mic.
ACE interface refers to the Adverse Childhood Experiences study, which was done through the CDC and Kaiser Permanente way back in the 1990s and has continued today. The state of Virginia, a couple years ago, pre-pandemic, put together a program where community members and professionals were trained to present this information to the community. So obviously COVID sort of hampered that, but Fairfax County has staff and community members through the PTA and other groups that are trained presenters. And then a total in Fairfax County through different county agencies and nonprofit partners, along with FCPS, we have over 60 presenters who are able to come out and share this information, which is a free program, just to make people aware, because again, everyone is affected by adversity, but it also really looks at resiliency, and what the research shows contributes to resiliency. So very much like the youth survey talks about protective factors, that goes hand in hand with the curriculum of ACE interface, which is how adversity affects us and what we can do to mitigate the impact.
Oh, thank you very much. Does it have specific programs putting teachers or staff or parents or children, assisting them in specific programmatic things, or classes, seminars, or something like that? Is it something? So you got the 60 presenters, and then you follow up with that. Sorry, not to interrupt you. I'm just trying to make sure I'm clear. And then there's additional programmatic stuff along with that.
So right now, the program is mainly the initial presentation, which the sort of basic version can be an hour. There's a full version that can be up to 3 hours that have different experiential exercises where people can discuss and process the information. And then from there, it's not really a prescriptive program where we say do X, Y, Z. The goal is for that the attendees, whether community members or perhaps a specific group. So say you work for Department of Family Services, that once people have this information, they would continue on with it and decide amongst themselves, here's how we want to use this information. So it's meant to empower people, but it's not a set course of here's 18 months with 22 steps. It's here's the information. It's very much meant to be for the community to be engaged and empowered to then however they want to run with that information with what will work for their specific community or connection, whether it's a church, a community, a specific school, or an organization. It's up to them how they want to really mobilize after they learn the information.
Great, thank you very much.
Yeah, you bet. Thanks, Jenna.
All right. Another question in the back.
Oh, of course there is.
Thank you. Yeah, that question and also suggestion reminded me of a program that I went through, which is the Youth Mental Health First Aid Program. It's also free for anyone to take, like online, also in person. I found it extremely helpful. I was wondering if you have ever heard about it or have plans to implement it with staff members.
Yeah, I think in my last division, actually, our students took that on as a training that they trained other students on because they wanted our students really to have those skills, but also staff was able to do it. I think it's 8 hours of training, and so it's a really big time commitment, and we were able to, I think our staff, we did it in 1.5 hour increments and picked the top, I think, 3 hours in 2 increments, but our students were fabulous about it. They became a trainer of trainers for student leadership. So they created a student wellness and well-being core. So I think, honestly, that was a tremendous asset during COVID. And that was even when we were not in schools. And then it continued coming back. So I think it's fabulous training.
Wow, that's awesome.
Yeah.
And are you guys still like running training days, or I don't know how you guys are structuring it, but are there continuous efforts?
Yeah, I don't think we've offered it in Fairfax County, but I'd have to defer to you, Dr. Presidio.
And I'm not positive either. That's something I could check on, but I mean, a similar program that we're working on trying to stand up is telemental health services for students and possibly for staff as well, because we know that it's really difficult sometimes for folks to be able to get in and, see a clinician, make an appointment, insurance coverage, all these types of things. So we're working to get some telemental health services set up. And we think we're on track to have those ready to go in January.
Yeah, the power of the mental health first aid is you're able to spot signs. Sometimes people don't even realize they're going through, like what they're feeling might really be a mental health episode, right? And so it helps if people around them are able to notice that. And then it gives students and staff the skills to talk about it because we have to destigmatize mental health. right? There's this feeling like we can't talk about it. Well, we must talk about it, right? So it gives us language to do that in a way that some people are afraid to talk about it because they don't want to cause more harm. And it really just is an opportunity to, to practice language that lifts up the concern and also supports one another, and to know when to get more professional help for somebody as well, right? So it's a tremendous training. I'm curious where you ran across it and what your thoughts are about, rolling that out more to our students and staff.
Yeah, exactly. How I think about it is very similar, where it's like CPR for the brain, right?
Exactly.
And it's very needed, where, we talk a lot about SEL as a focus area here for the ESSER funding. So I actually, I work a lot with students and also, in high school, but college and, young adults. And I do a lot of work in coaching, also, helping students prepare for, their life beyond just school. And so the youth mental health first aid was something that we as a team saw as a need, right? Of like, this is a requirement for us to go through because we work with students all the time. And so I actually have a story to share. So I also told one of my family friend who is a teacher at an elementary school in actually Maryland, in Montgomery County. And she took the class, she thought it was awesome. She works with special needs students as well. And so this class, after taking it, she was able to help a student who has always had kind of emotional issue with other teachers as well and other students. And after the class, she implemented one of the strategies that she learned and actually helped the child to get through one of the episodes that she was having. And other teachers started coming up to her, was like, how did you do it? Like, share with me your secret, your tips. And so I think that is one of the anecdotal, evidence that we can see. But I think, as you probably already know, youth mental health first aid can span, much more benefits than just, one time, incident, or, it can span across, different situations beyond just the classroom as well.
Right, and just a couple comments on that. We know that mental health touches 1 in 4 people, far more actually even than heart attacks, right? In terms of the use, and we do require CPR as a graduation requirement. And so it kind of begs the question, right? Should we require mental health first aid as well? Because we're more inclined to run across that probably than folks experiencing a heart emergency. Also, I think one of the things we know in adolescence is we often, serious mental health can go undiagnosed for a number of years as well. So you make a good point. Yeah, good point. Thank you.
Thank you. So I think we scheduled this till 7:30, and we're getting pretty close to 7:30 if we're not already there, but we don't want to cut the conversation short if there are additional comments or questions. I'm not seeing anything from the online space. So if you're online and you have another question or comment, please raise your hand before we wrap up. And anybody else in the room that might have anything before we wrap up?
I think I'd like to introduce our board chair who's here this evening, Ms. Rachna Sizemore-Heiser. And would you like to wrap it up for us? Just a couple words.
Just really busy. Thank you for coming out. And for those of you online, thank you for joining us online. And I know it's a busy time of year, and your feedback and your input and your sharing of information. I think what I love about this is the sharing, right? Of here's some programs that I went through that helped me. Here's some program about ACEs, because all of that helps us do our job better and helps us understand how we can really target our funds where the needs are and things that we can do that have made a difference and have been shown to work. So thank you for coming out. Thank you for all your feedback, and we really do value it. So I appreciate your time.
All right. I think that's a wrap.
It is.
All right. Thanks all.
Happy holidays.
Yeah.
Thank you to our staff. I meant to say thank you to our staff for.
Yeah. All right. And thanks our communications team. Thank you all. I know it was another night out, and I appreciate it. You guys have been fabulous. So thanks OCCR as well. Armand? Here we go.
Who knew we'd see each other again? So thank you all.
I feel like this is turning into a psychiatric